Urgent alert. WHO just raised its emergency level to its second highest level. This comes as the World Health Organization, WHO, has been informed of the detection of a new variant in South Africa. The variant has been named Omicron by scientists. This is our news channel bringing you the latest updates on the new variant. In today's video, we will discuss what the WHO Director General said about this new variant. What are the symptoms associated with this new variant? And how worried should you be right now? So make sure to watch the video till the end. And don't forget to subscribe for future updates. The World Health Organization says it is closely monitoring a new variant of the coronavirus that was first detected in South Africa. The WHO Director General Dr. Tedros Adhanom Ghebreyesus announced on Monday that the global health body has raised its emergency level to its second highest level, saying the variant may pose a risk to global health, and warned countries against implementing blanket travel bans. At a news conference, he said, "Our scientists are still analyzing the variant, but preliminary evidence suggests that there has been an increase in transmissibility." He also mentioned that more than 1,200 people have died of COVID in South Africa over the past week, up from 48 the previous week. A few days ago, South Africa alerted the WHO about the detection of the new variant. According to the WHO, preliminary evidence suggests that the new variant has an increased risk of reinfection. It said that there have been no deaths associated with the variant so far. However, according to experts at the WHO, there are still many unknowns about the new variant, including whether it is more deadly than other variants of concern, such as the Delta variant. Currently, the WHO has classified this new variant as a variant of concern. In addition to hoisting the emergency alert to its second highest level, the WHO has also categorized the new variant under the Greek alphabet as Omicron. The variant is known as B.1.1, 529, and belongs to the SARS-CoV-2 lineage A. At present, there have been a total of 34 sequences submitted to the global database from South Africa and Botswana. Dr. Angelique Koe, chair of the South African Medical Association, told Reuters that the variant has not yet overwhelmed hospitals, but warned that it could become a serious problem if preventive measures are not taken. She said, "We don't know much about this variant at this stage. It is showing an unusual pattern of infection." She added that those infected with the new variant had mild symptoms. Dr. Richard Lessels, an infectious disease expert at the University of Cape Town, who has been involved in treating patients mostly in the private sector, said the number of patients admitted to hospital with COVID-19 had risen sharply in the past week or two in some parts of South Africa. But he stressed that most were mildly ill and did not require intensive care. He said, "It is still early days, but at least with the patients I've seen, and I think others have seen, it doesn't look like there is an increase in severity." According to scientists, the variant has more than 30 mutations, including more than a dozen on the spike protein that the virus uses to enter human cells. Spike proteins are crucial for the virus's ability to infect human cells. Mutations in these proteins can help the virus to enter cells more efficiently. But scientists say they need more time to understand what impact the mutations might have. South Africa's National Institute for Communicable Diseases said on Friday that it is detecting the new variant in about 20% of samples. It said that the variant appears to be spreading to all age groups equally. Now the question arises, why has the WHO raised the emergency alert level? Maria van Kerkhove, the WHO's technical lead on COVID-19, said, "We know from experience now that when we see an increase in one region, often it will spread to other regions." She also explained that because of the variant's high number of mutations, which could prove to be very transmissible, the WHO believes that it may pose a risk to global health. But according to Dr. Bruce Aylward, senior advisor at the WHO, it is too early to say whether Omicron is more transmissible than the Delta variant. He said that the world should prepare for the worst but plan for the best. He said, "I think it's important to stress at this point that we do not yet have sufficient information to say that it is more transmissible." The WHO's Director General has urged countries to strengthen their disease surveillance and response systems to identify and sequence any positive cases and to share their findings with the global community. On the issue of imposing travel bans on southern African nations, the WHO chief said that while he understands the move, especially after seeing what happened last year with the Wuhan virus coming out of China, he said, "Travel measures alone may not effectively prevent the international spread and should be implemented strategically." He added that the blanket bans on southern African nations would only fuel stigmatization and racism. Tedros said, "The way out of this pandemic is with solidarity and cooperation, not with stigmatization and blame." He also said, WHO recommends that countries implement the emergency brake on the import of animals from affected areas to reduce the risk of further introduction of the virus into their countries. Scientists say it will take weeks before they can determine how contagious the new variant is and whether it is more resistant to existing vaccines. On Monday, Israel said it would bar most foreign travelers from entering the country and would require Israelis returning from South Africa and 6 other African countries to quarantine for 3 days. South Africa's Health Minister Joe Fala said the country is not restricting movement or closing borders. He said, "We continue to work closely with the World Health Organization and our counterparts in other countries and with our scientists who are working day and night on this matter." Although the variant is highly transmissible, the head of the WHO's Emergencies Program, Dr. Mike Ryan, said he believes the global health system is better prepared for it than the Alpha and Delta variants. He said, "We have learned a great deal about this virus since then, and we have tools that we did not have at that time." Now the question arises, what are the symptoms of this new variant? Some of the earliest known cases were in a group of young men who experienced mild symptoms, such as a sore throat, fever, and a cough. None of them ended up in hospital. As of November, the variant has been detected in a wide range of people, including children. The majority of infections have been in the northeast province of Gauteng, home to the capital Pretoria and Johannesburg. More than 1,000 people have been infected with the variant in Gauteng. According to scientists, the variant is expected to cause a surge in infections. Earlier, South Africa's Health Minister Joe Fahla said, "We are expecting that this could be a potential tsunami. We are looking at a situation where we could have a large number of cases coming in a very short period of time." And now for the most important question, should you be worried? Well, the answer to this question was given by the WHO Director General himself. He said, "For now, our scientists say the overall risk to global health remains unchanged." However, he also emphasized the need to strengthen surveillance in order to keep track of the variant. He said, "You cannot rule out the possibility that the variant may lead to surges in cases and could pose a risk to vulnerable populations." On Sunday, the UK's 4 chief medical officers raised the risk level to its second highest level, saying it is likely that the variant will arrive in the UK soon. They said in a statement, "It is not yet clear whether Omicron can be transmitted between humans. However, the evidence from South Africa suggests that it is doubling in size every 2 to 3 days." The statement read, "Given the evidence of its rapid growth in South Africa, there is a chance that it could become dominant here in the south of England in the next few weeks." Israel is among the first countries to impose travel restrictions on passengers coming from South Africa. It has banned entry to all foreign travelers who have been in South Africa, Botswana, Zimbabwe, Mozambique, Namibia, and Lesotho within 14 days before their scheduled flight to Israel. People arriving from these countries will be required to isolate themselves for 3 days at a hotel at their own expense. So that's all the latest news. We hope you found this video informative. If you want more info on similar topics, check out our other videos. Thank you for watching and stay tuned for future updates.